everyone. My name is Sabrina, and I'm a licensed massage therapist and certified cosmetic surgery specialist. And this is Talk Plastic Surgery, where we talk about the good, the bad, and the ugly. And on this filler episode number 2, on series number 2, we had the pleasure of speaking with the lovely Karina.
While I was going through it, the recovery, it was very annoying, irritating, not being able to use my arms. It was hard. However, after I got through that, so much better. My confidence is definitely a lot better since then.
Mary.
It was devastating. Coming back around to it now, finally, after this many years, I am talking with my therapist saying, you have PTSD. There's never not a day that this doesn't affect me.
And Catherine.
It's not like some type of nagging source of insecurity for me. Like nothing physical is a source of insecurity for me. I have insecurities, but they're about things that are way deeper than you know what I mean?
Yeah, yes, I do know what you
I like
mean.
to be balanced, but I'm also just obsessed with aesthetics. Like I'm just obsessed.
Yeah. And so without further ado, let's begin this filler episode, concluding segment number 2. So on Karina's episode, she was our first ever guest that had the pleasure of speaking with about brachioplasty. And so for everyone, a brachioplasty is an arm lift. That's when they take off the skin from the arm and then they tighten it up. And sometimes the incision can go from here to here, or they can cut inside the armpit. In your situation, they ended up doing an incision from here to here, right? Like right across the arm.
Mm-hmm. Yeah.
So dealing with the chin lipo, with the skin tightening, and the brachioplasty, which procedure do you think was harder to recover from?
Harder to recover from. I'll say that the double chin was more painful. As far as recovery goes, the arms were not painful at all. Really no pain. However, what you have to do is for like 6 to 8 weeks, you have to be in T-Rex arms the whole time.
Yeah,
so
yep, you do.
That's the hard part. Not being able to reach anywhere, just being T-Rex the whole time. That was the hard part. So it was more, I would say, mental than anything else.
Yeah, and so when you were in like T-Rex arms for that long, did you end up having any complications on your brachioplasty? Like where the incision tore open or anything?
I did have very small openings, maybe like 2-3 very small openings. They healed in like a few days, but nothing too bad. Unfortunately, I was not very good at staying in T-Rex arms, so I think that's what caused it.
Yeah.
But yeah, it wasn't too bad. It was very tiny openings, and they were healed pretty quickly.
Okay, so Karina was our first brachioplasty who came on the show. So what is a brachioplasty? A brachioplasty is an arm lift. So sometimes when you have a lot of excess skin, that's the majority of people who have a lot of excess skin, and they want to get their arms lifted so they don't have so much skin down here. So with a brachioplasty, they will generally cut from elbow to armpit or even elbow all the way down by the side of your either breast or pec so that they can lift the skin and minimize sagging or the appearance of a big arm. Now, that being said, sometimes they will do arm lipo so that you can go ahead and minimize the appearance of the arms. But if you don't have a lot of good skin elasticity, then it would be better for you to go and have an arm lift. Now, that being said, in the age of drastic weight loss, a lot of people are opting more for brachioplasties. So what I really want to talk about today is that when you are going to have a brachioplasty, and if you want some advice, go back and watch Karina's episode. She gives some excellent advice, but you are T-Rex arms, like she says, for quite some time. Now, I have seen a lot of brachioplasties, and when you get a brachioplasty done, there is a possibility of having complications where the incision opens, especially by the armpit, because when you're opening your arm, sometimes you don't realize it, you overextend and you pop a stitch, and then it can open up that incision. So when you do get a brachioplasty done, my opinion, my suggestion as a cosmetic surgery therapist is do that surgery on its own or pair it with a breast lift or a dorsoplasty. A dorsoplasty is when they lift the back skin up. And we'll get someone on the show who has a dorsoplasty soon. That being said, you do not want to have that procedure along with a procedure where you're going to need your arms a lot. You want to have that procedure either on its own or with an upper body surgery, because when you're using your arms a lot, especially if you have a lower body lift or especially if you're getting your thighs done, then what can end up resulting in is a complication of the incision opening up. My best advice is that you do not want that incision to open up. Do it on its own. But thanks, Karina, for coming on the show. And let's move on to Mary. So Mary came on the show and we talked about necrosis.
We're supposed to do. But we realized, well, probably sooner than a couple weeks actually, because my belly button did not survive. I think you saw me before it all happened.
I saw you. I saw the aftermath.
Right.
Because that's when I went to try and do massages, and then
you're like, this is necrotic. You were flipping out.
Necrosis.
Yeah.
This is necrosis, and the necrosis was actually spreading from Mary's belly button all the way down into, like, from hip to hip.
Right. My incision, well, we'll get there.
Yeah, we'll get there. Okay, so now.
No spoilers.
No spoilers, guys. No spoilers. So, of course, I kind of want to leave it open-ended because Mary's episode was so good. I highly, highly recommend going back and rewatching it. She gives so much excellent information about her experience and her story with necrosis. Mary also popped my necrosis, how do we say, visuals. But anyways, so Mary was my first patient that I ever dealt with that had necrosis. And the first time that I saw it all those years ago, I was literally astonished. What is necrosis? Necrosis is actually a flesh-eating bacterial infection that I like to describe in layman's terms as like a zombie effect. So it's basically like your flesh is eating itself and it's causing necrosis. And it looks black. It looks scary. It literally, you could see your flesh dying. Yes, it's very scary. I'm so proud of Mary for handling it like a champ and all these years later being okay and dealing with it back then. That being said, when you end up developing necrosis, when you have plastic surgery, it is very, very serious. You have to go to the doctor immediately. As soon as you even sense that you have this, call your surgeon. Call your surgeon right away. Make sure that you get it handled ASAP because you need antibiotics. You need wound care. You need a team to really help you get this under control because it can become septic, because it can become a bigger problem. Handle it immediately. So if any of the viewers that are watching this that are thinking about having surgery or already had surgery and they're seeing their wounds and they're like, my wounds look kind of weird, or if you are having surgery somewhere else and you're watching this for research, then and after the fact you have your surgery, everything looks great, but then something feels a little off, contact your surgeon. I'm a huge advocate. When you come to me, I facilitate you in all of your recovery needs. That being said, I know my basic wound care. I'm a massage therapist. I'm not a wound care specialist, but I know the basics. And I always advise if I see anything weird, call your surgeon. Call your surgeon. If your surgeon's not here, still call him and then get you to a wound care specialist. So, and with that being said, wound care, making sure that if you have any infection, any signs of infection, that you have a good team to help back you up with that. Okay, guys? So if anything looks weird, out of the ordinary, contact your surgeon. Get help. Contact wound care. And make sure that you find a good wound care specialist that knows about plastic surgery. That's another big thing. If you don't know someone that knows plastic surgery, then sometimes they can't really help you with wound care as best as someone who already has seen these types of things, especially like something like necrosis. Necrosis is very, very serious. So on that note, Mary, she did give us a new suggestion.
Get a therapist.
Everyone
says do your research. Get a therapist. Because
yes, we got a new recommendation.
If your mind isn't prepared to handle what could happen, the mind is such a big, strong motor that drives everything.
Yes,
it really, truly does. And strong mental health can change everything. It literally can be the linchpin in anything that you do.
Mary suggested that you get a therapist after you have plastic surgery, which I can't agree more with, because at the end of the day, this is a very emotional journey. If you have been watching this far, and this is filler number 2 of series 2, which I think is like episode 28. Yeah, this is episode 28. So if you've been watching this far, you know this is a very emotional journey. We hold emotional trauma in our body. I sound like a broken record. I've said it countless times, but we hold emotional trauma in our body. And at the end of the day, when you go through major surgery, it can actually trigger all of that. So anything that you went through years ago, you go in, you have major surgery, and that comes back. And it can even come back with a vengeance. So you might feel all these feelings. All these things might come rushing into you that you didn't even know that you had stored within you, but you never really had the opportunity to deal with it. Now, I do know, I follow a surgeon on Instagram that she actually gives 3 counseling sessions along with, that's included with her procedure costs, which is so beautiful, so admirable of her, because when you are going through this, it is good to talk to someone about the change that you're making with yourself. You are making a huge change with your physical appearance and with your appearance in general, that it is good to talk to someone about body dysmorphia or about traumas that you're feeling that have arisen from having surgery. And 3, how you are feeling throughout this recovery, how you're feeling now that you are kind of incapacitated momentarily, you need help. A lot of us that like me, like I'm a go person. So me having to be stationary for a while, having to have help from people, it can be hard and it can be challenging. So definitely having someone guide you and help you along that is wonderful advice. Thank you so much, Mary, for coming on the show. And now, Catherine. So my dear friend Catherine, it was so much fun talking with Catherine because we've been friends for a while too, and just the amount of surgeries that she's had, the amount of surgeries she's thinking about having, the knowledge that she has with the surgeries that she's gotten. It was so much fun speaking with Catherine. And on that note, Catherine talks about her autoimmune disease problem that she has, lupus.
And I do think I may opt to have my boobs taken out at some point. And then just like lifted and then like maybe put some fat in there or something, because I'm seeing better results with that. And I have lupus, so I have an autoimmune condition, and my body doesn't really respond very well to foreign substances.
That makes sense. And it's true.
Yeah.
Yeah, women that do have an autoimmune, they don't respond well to implants at all.
Yeah. And I can't really say like there's nothing I can pinpoint and be like, oh, I'm having this problem because of that. But I have noticed a little bit since I've had them for like 2.5 years. And I have been struggling more with inflammation. I've been struggling with a lot of more inflammation in my face. And you know that because I always tell you to like do lymphatic on my face.
Yes. Yes.
And so I have an inkling that that's maybe a reason.
It could be a huge factor,
Yeah.
honestly. And now that we're having this conversation, and I have a patient who has an autoimmune too, and she got a breast lift and just put some fat transfer in her boobs because she even told me there's just no way she can have a foreign object in her body because her body will really try to reject it. And a lot of that inflammation probably is because of your lupus and having silicone inside of you too.
Yeah.
So now, I have had a few patients that have autoimmune problems. And so, on that note, you can have plastic surgery if you have an autoimmune, but know the risks. Consult your doctor. See if this is something that would be okay for you to go down. Now, having implants in, like Catherine said, she feels like it might be affecting her. I know another patient that has an autoimmune that chose not to get implants because she knew the risks of it affecting her. And there's actually a lot of risks. Like if you have lupus, you are more higher at risk of having skin problems arise. If you have an autoimmune, you will probably be delayed in your healing. It will take longer for you to heal because of your autoimmune. Does that mean you can't have plastic surgery? Of course not. That means that we have to take extra steps, extra precautions, and maybe a little bit more recovery time for you so that you can have the most optimal healing. Now, on that note, Catherine did talk about something that I don't think we've talked about on the show this far. So go ahead and play that clip, Jovi.
Yeah, but I would definitely, we're going back to like accessibility for just like finances or whatever. I would totally never, ever recommend for someone to do something that they can't afford.
Yeah.
Like, and I see a lot of girls doing that.
Yes.
And then what you have to, I mean, I'm not sure if I mentioned this before, but something I had thought that I wanted to mention is that like you have to assume that something might go wrong that actually looks worse than you started with. And so you have to fix that, and you have to have the money to fix it. Otherwise, you're going to be left with a outcome that's worse than it started.
Yeah.
So if you don't have the money to fix something, then don't even do the surgery in the first place, in my opinion.
So Catherine talks about that in her opinion, that if you don't have the money for having plastic surgery, you shouldn't have it because you have to be prepared for the repercussions. Like she did. So Catherine went in at a fairly young age, 27, to have a facelift. And she felt like it didn't help her. And actually now, and then she put fat in her face and then she had to pay more money to get it removed because it didn't look good on her. Now we have the show, the good, and we talk about the good, the bad, and the ugly because there is a huge possibility of you going in and having surgery and not being happy with the outcome. Of course, let me tell you a big thing of why that could happen. One, you get improper aftercare. Now, if you go in and you're not getting the proper massages, you're not following the 5 keys, nutrition, massages, compression, exercise, mindset, then you have a higher chance of not having an optimal outcome. If you're going in and you're getting massages where they're opening your incisions and pushing fluid out, you are going to have complications. You are not going to have a flat stomach. You're going to have fibrosis. That is going to be detrimental to your recovery. That's going to be detrimental to the look that you're going for when you went in to begin with. If you had a facelift and you're going outside, you're not wearing sunscreen, you're not taking care of your face, it's going to darken your incisions. That will be a problem. If you don't do your research, if you don't see the outcomes that your surgeon has had in the past, and if you don't talk to people who've gone to that surgeon, and of course, if you have any questions about some of the bad outcomes on the show, wink, wink. Anyway, if you've watched the ugly stories, the bad stories from talk plastic surgery, you will see that not everything is roses and rainbows, just like we said in Patty's episode. You will end up spending more money fixing what another surgeon did, fixing what another post-op care person did. If you do not actually do your due diligence, follow the 5 keys, then, and it's true in some sense what Catherine said, you have to be prepared for the worst thing that could happen, and that's you spending more money to fix yourself, than if you go in and you spend just the minimal amount. Let's just put a number out there, like 20K. Say you go in, you spend 20K and you think that's it. That is not it. 100%. A lot of people on the show, they talk about how you need to have money aside for aftercare, which is 100% true. You are not just spending 20K on your surgery. You're going to probably spend 25. Now, that is if you're staying local. If you're going out of the state, you got to think about flights. You got to think about food. You got to think about living expenses on top of your surgery. So if no matter what, budgeting, I think, is the best advice that we could get from what Catherine said, because no matter what, if you are unhappy with how you look, if there's one thing you want to change, if there's a surgeon that you like that has a deal and you have the money, you have good credit, you want to take out a credit line. Now we have care credit, so you don't have to just save all of your money. You can take out credit, and I know plenty of people who do it. They take out credit and they go get the surgery. But follow the 5 keys, guys. I can't stress that enough. If you want to go that route where you're going to use credit to help you pay for your procedure, to help you pay for your aftercare, go for it. I build my credit too. That's how I am. I use credit for things too so that I could build my credit. And why not go spend the 10, 20K, use credit and pay it off and build your credit, right? And then eventually use that to buy things that you want, and you're going to have great credit because you're going to pay things off. So no matter what, surgery is out there. It's open for everyone. We are all on our own journey. If you want to go that route, go that route. Highly suggest you follow the 5 keys. You find people who are professionals that are actually going to facilitate you on your healing journey so that we can bypass you getting botched, bypass the possibility of having to spend more money to fix what someone else did and inflicted on you. So guys, at the end of the day, the advice that we give that is like a broken record, we say it over and over and over again. Do your research. Do your research. And to conclude our filler episode 28, guys, segment 2 on series 2, I just want to give a big thanks to these 3 beautiful ladies for coming on the show, sharing their story. It was very powerful. A lot of beautiful information. If you have watched this far, the views keep going up. I really appreciate everyone who watches the show every week, who stays tuned for all of the great things coming up. And if you have watched this far, I'll give you a little sneak peek into the future. So we are already working on series number 3. We are starting series number 3 off with a bang. We're going up to Salt Lake City in a few weeks. Right now I'm filming this in October. It's going to air in a few weeks in November. But we already have Series 2 completed. We have an incredible plastic surgeon, my favorite probably plastic surgeon in Las Vegas, that is ending series number 2 with a bang. We're going to New Jersey and we're meeting with an incredible massage practitioner that I'm so excited to bring on the show. And we're going back to a local establishment here in Las Vegas, Nevada, and interviewing someone that is very dear and near to my heart, on top of the person that we just had on at the end of series number 1 as a professional. So guys, if you stayed to the end, that's a little sneak peek into the future. Can't wait for you guys to see who comes on the show next. And stay tuned for segment number 3 of series 2, where we have a Shroom-nonymous guest come on the show and share her ugly experience with her plastic surgery journey, but then ended up with a wonderful experience. So guys, without further ado, like, share, subscribe, hit the push notifications for all things Talk Plastic Surgery. Bye!